So you'll see that sometimes the list is very stagnant for a couple of years, and the same kinds of things stay on it. But in other years, new things creep on or other things drop off in our top 10s. Doesn't mean that those others are not ever cited. It just means that they're not cited quite as frequently. One of the things that you'll notice is for acceptance of patients, the plan of care, medical supervision, all of those things for home health agencies are the largest problem. About 33% of those agencies that we enter and provide oversight for have issues with those areas, and so we do cite that quite frequently. Another thing, and this is new, is the OASIS citations. None of those were on the list for being top 10s in the previous year of 2010, but then in 2011 they did creep on with 3 actual citations. Let's look at the management responsibilities of the administrator. Your administrator, really, they should have it on their desk. The buck stops here, right? To some extent. Certainly the licensee has a higher responsibility, but they're not carrying out the day-to-day functions of the agency, unless the licensee happens to also be an administrator in a small mom-and-pop kind of agency, right? But we believe and feel strongly that the administrator is that individual who should be overseeing all of the services that are delivered by your agency, making sure that your policies are appropriate, again, making sure that individuals are carrying out the functions of those policies and procedures, that they are well trained, that they have the qualifications to be in the positions where they are located in your agency. The most common problems by the administrator really is failing to see that your staff are trained. When we interview staff, they should know what the policies are. They should know how to act in a specific situation in all of the areas where compliance is a requirement. At the very beginning, and back when I showed you just one of the slides for the conditions of participation, I did ask you to, think about your plans of care. Think about your communication. Think about what the interactions are and how you're reviewing plans of care in your agency. And not just the plans of care, of course. We already set up that I'm also talking about care plans and ISPs for those agencies that are providing personal assistance services only. But you've got to really be looking at how you're communicating, what you're telling individuals, how you're training individuals. That is the body of the licensing standards and the body of those areas of noncompliance. What are the things that came out of the last year and in our annual report to talk about what are those areas of noncompliance that we're seeing for all agencies, PAS, home health, and for hospice. Now let's talk about how we got that information and how when we come into your agency, our expectation of what you must do is going to meet with our expectations for what our surveyors must do.